Welcome everyone. Thanks for coming. It's a sunny day, so we appreciate you choosing to come here and attend a webinar rather than go and do something like eat an ice cream outside. It's made possible by ExChange Wales, who are an organisation that's based in Cascade at Cardiff University, and that's the research centre that we're all based at. It's funded by Welsh Government via HCRW, Health and Care Research Wales. ExChange aims to disseminate research through delivering workshops, conferences and webinars like this one. And the idea is to enable dialogue between researchers, practitioners, experts by experience, and anyone else really. So it's a way of us kind of telling people about our research and discussing it and finding out what people make of it. So the session is about a study that we've been working on. So the people who are going to be involved in running it are myself, Verity Bennett and Phil Smith. And we're part of a bigger team that's actually across Cascade and then two other centres. So the other centres are the Centre for Trials Research at Cardiff University. So they're based in medical school, and also some colleagues at the Nuffield Department for Primary Health Sciences at Oxford. So it's a collaboration between the three centres, and we're sort of representing the wider team. The study is called the SWIS Trial. It's an evaluation of an intervention called social workers in schools, and it kind of comes after some pilots that we did previously. So it's kind of the latest thing in a programme of work that's been going on for a few years now. Okay, so the plan for the session is I'm going to do a bit of an overview to begin with, say something about the kind of background and the rationale for social workers in schools, and why people thought it was a good idea, why it was kind of designed, and how it's designed in the way that it was. Then we're going to talk about the study, how the study was designed in the way that it was. It's quite a relatively unusual study design. It's a randomized trial, which I'll say more about what that is shortly, but they're getting more common in social work, but they're still not that common, and in some ways they're controversial. So we'll say a bit about the study design, and then we'll spend the bulk of the session on the findings. So we've got lots of findings to discuss, and we're going to go into a lot of detail about different types of findings. That includes sort of quantitative data, qualitative data, and a whole range of stuff. So we'll have a discussion about that, and then we'll sort of tie up the loose ends and sort of reflect on what it all means, hopefully, at the end. So I think that's pretty much all covered. As I said, it's a big study, so it's a chance to learn about that. And in fact, I think it's the biggest study of its kind, certainly in the UK, possibly in the world. As I said before, there's a lot to take in, so we are going to have a short break in the middle for people to get a drink or whatever. So just to begin with, I thought it was worth talking about what school-based social work is, because it's not that common in the UK. So it is a sort of a subdiscipline of social work, I suppose, and it's quite common across the world. So in certain countries, a lot of schools have social workers based within them, particularly in the US. So in the US, it's been a kind of a thing since, I think, the early 1900s. And in Australia, in Hong Kong, I think in Canada as well, it's relatively common to have social workers based in or working in schools, but they do tend to work in different capacities. So it's not necessarily kind of social work as we know it. In fact, in the US, when it first started, they were called visiting teachers, and I think that kind of gives a sense of the type of work they did. I think it's much more, in many of these places, it's much more akin to a kind of education welfare officer, or a kind of a teaching assistant, someone who we would have in our schools, but not in a social work role. And a lot of the outcomes they're trying to help children with are educational outcomes, rather than kind of child protection outcomes. So social work obviously it varies across the world anyway, but school-based social work is particularly variable. And there isn't that much good research about it. So there's a range of different studies, but in terms of evaluations, there's not that much good evidence about the extent to which this helps children achieve whatever outcomes that they're setting out to achieve. So, but in the UK, it's not really, until recently, it wasn't really very common at all. So there are examples, and you may have worked in schools. You may be familiar with examples of social workers being based in schools, but it's not commonplace. It's not widespread. And a few years ago, I think in sort of 2018, the Department for Education took an interest in this. There's lots of reasons I think they're interested in it, partly because that they've been trying to improve multi-agency working between schools and education and other agencies for a long time. It's obviously proved it's kind of a hard nut to crack, because there's constant kind of criticism about how agencies work together. So I think they saw it as a way of trying to do that. There's also been a huge increase in the number of children receiving services. That goes from like referrals to children's social care right through to care itself over the last 10 or 15 years. So there's a kind of a desire to try and reduce that or prevent that increase from going any further. I think there's a general sense that it's unsustainable and undesirable to have that rate of children receiving services. There was a care review, big review of the care sector a year ago or so. They in that document, they highlighted schools as being really important, and their role in terms of safeguarding should be enhanced. And they already have quite a big role, because they tend to refer a large number of children to children's social care. So it's only the police that refer more children, I think, generally. If you look at the data over a few years. So as I said, 2018, the Department of Education got interested, and we did some pilot studies in 3 local authorities. We found that generally it was well received, so people liked it, both the social workers who worked in the schools and the schools themselves. They were quite happy with it. They could see lots of benefits. We also did a sort of pilot impact study and looked at what impact it had on some key variables, so some key children's social care outcomes, particularly child protection investigations and child in need assessments. And we found there was some indications that there might be a way of reducing the need for those. So that was kind of encouraging. But also more than that, I mean, the pilots were more about the qualitative evidence. So we did much more qualitative work than we did quantitative work, and the numbers are obviously limited. So the qualitative elements were really positive too. So as I said, lots of benefits were cited, and it seemed that people thought it was a good thing. So that kind of laid the groundwork for this current study that we're talking about today. In the pilots, we looked at a few different kind of areas. So we wanted to know if it was promising. That was kind of probably the most important thing. Was it worth trying on a bigger scale? What are the benefits? Are there any unintended consequences? Because there often can be with interventions like this that people haven't thought about before. We also wanted to know how feasible it was, because obviously schools, they're quite different. Some of them are tiny, some of them are huge. They're organised and managed in different ways. So it was quite possible that it wouldn't be feasible to deliver something like this across a number of schools, but we wanted to check that, and it turned out it was feasible, with some adaptation and some variation built in. We also, as I said, looked at impact and some outcomes, and we wanted to know whether it was ready to do a trial. And when I say ready, I guess I mean, is it clearly defined? Is it a thing that you can describe and then sort of replicate in lots of different places, or is it kind of a woolly concept that no one really understands? So these are the things we looked at in the pilots. And we found that overall it was kind of it was suitable and worthwhile to try and look at it in a bigger way. Some of the indicative findings, as I said, it was tailored because the schools were so different that it needed to be a bit variable and a bit flexible. One of the key things that came out was the relationships. So people felt that it made relationships between social care and education much better. You didn't have to email and do like lots of phone calls and things. You could speak to people directly, and that was thought to be a benefit. The role itself, I think this is interesting given what I said about what it's like in other countries. The kind of remit seemed to be under constant negotiation. So often schools wanted social workers to do things that they didn't feel was their role, etc. So that was kind of an interesting aspect. But understanding of the roles in both directions, kind of schools understanding what social workers do and vice versa, seemed to be improved. And as I said, generally people liked it. We also, as I said, looked at the impact evidence. This is on a small scale, but basically everything to the left of that central line, the vertical line where the 1 is a reduction. And these two particular indicators were kind of significant reductions. So section 17 is in pilot 3, so that's child need assessments, and section 47 is in pilot 2, I think it was. So that's child protection investigations. They both reduced in the schools that had a social worker compared to a matched group of schools that didn't. So that kind of gave us, or gave the DFE particularly, enough confidence to think this is worth trying on a bigger scale. So that's a very quick sort of whistle-stop summary of the pilots. I can see there's some chats, but I'm assuming, Phil, that they're that's just showing. Okay, I'll ignore that. I'll leave that to you. So yeah, so that's the pilots. That kind of it's helpful context, I think, because it shows why we went from a small study to a bigger study and the kind of the reasoning and the decision making that went on. So I'm now going to talk about the design of the trial, which came after those pilots, and particularly the research questions that we were looking at. For some reason, sometimes the keys on my keyboard work and other times they don't, so I'm going to stick to my mouse. Okay, so as I said in the intro, I think we think it's the largest ever RCT of a school-based social work intervention. We're certainly not aware of anything bigger. We worked with 21 local authorities in England, and they were spread across the different regions, and I think we had pretty much every region of the country covered. There's a range of different types of local authorities as well. So we had big rural authorities, we had small like London boroughs and other sort of metropolitan places, so quite a range, and also a range of different schools. So in total, we had 291 schools. Roughly half of those got a social worker. The other half were just carried on as normal, and they were the control group. And within those schools, we estimated there were about 280,000 students. So in terms of the numbers of people involved, it's large. And that's good because it means that the study has enough data and enough observations, I suppose, to mean that we're confident in the findings that we've ended up with. It also gave us a lot of scope to do lots of qualitative work and lots of other quantitative work to try and understand how the intervention was being implemented, which Verity is going to talk about shortly. Okay, so the study itself, there were kind of 3 pillars to it. There's the impact evaluation, and as I said in the pilots, we kind of lent towards the qualitative evidence, the kind of process stuff. We did a bit of impact stuff. With this study, the impact evaluation is more the sort of central plank. So we called it a pragmatic cluster RCT with 2 arms, which sounds complicated. I suppose it is, but basically it just means it's pragmatic because it's about what we're looking at, what happens in the real world, not kind of ideal conditions. So we let these authorities implement SWIS in their own way. Essentially, they did have a manual guiding them, but we didn't sort of clearly keep them to a very sort of narrow iteration, partly because it needed to be variable and flexible. Cluster just means that we randomized schools rather than individuals. So the school was the unit of randomization. The RCT is just that we randomized between 2 groups, that's 2 arms. So the schools that got a social worker and the schools that didn't. So it's a relatively simple thing, really. You just decide at random who gets it, who doesn't. And the benefit of that is that it gives you a good comparison and a fair comparison. And it means that the only difference in theory between the 2 groups is that one lot got social workers and one lot didn't. So then the data for that part of the study was supplied by local authorities. So we had a really good relationship with our colleagues in each local authority who supplied us with data that helped us analyse the impact. Now, alongside that, we had what we call an implementation and process evaluation, which is all about how's it being done. So although we were fairly relaxed about how different local authorities kind of adapted it, we wanted to know how they adapted it and understand how that variation, I suppose, and anything that might impact on the outcome. But also it's just worth knowing how these things are implemented, because if you're going to roll it out further, then you learn valuable stuff. And that was based on a mixture of different methods. So we did some interviews, lots of qualitative interviews, semi-structured interviews with different professionals, with students, with school staff, social workers, managers. We also did surveys. So we ran lots of surveys, and that was to collect data on the different kind of approaches that were being used. We also used some of that data to try and come up with a kind of quality rating. So we had the manual that the funder provided that kind of outlined how they thought it should be done, and we assessed how each school was doing that, as far how closely they were sticking to the manual, using that survey data, and each one got a rating, if you like, of gold, silver, or bronze. The reason for that was to try and help interpret the impact findings, and also to assess how closely to the manual it was delivered. And again, Verity's going to say a bit more about that later. The other pillar was the economic evaluations. So it's always important to find out whether these things are cost effective. So colleagues at Oxford did a very thorough cost effectiveness study to understand the costs associated with delivering SWIS, and also whether it was whether there was a cost benefit to doing so. In terms of research questions, we looked at impact on a number of different things. Now, you'll remember the primary outcome here is Section 47 inquiries. Now, it's mainly because that's one of the things we found in the pilots. It's also because that's quite an important point in the kind of child protection process. So it's a key sort of point at which children are deemed at risk of significant harm. So that was chosen as the primary outcome. We also looked at other outcomes which are on the slide there, including some care outcomes. The third one, number 3, I don't know why it's number 3 in the secondary outcomes, I suppose. Maybe it should be number 4. Anyway, that one is about educational data, so educational attainment and attendance. We haven't done that bit yet, so we're doing that later this year because the data's not available yet. But the rest of it we've done. For economic evaluation, it's a pretty straightforward question, really. What's the cost effectiveness associated with SWIS? And for the implementation and process, the broad questions were about, was it implemented as intended? What evidence is there for the mechanisms of change? So we identified kind of what were the ways in which it was assumed to make a difference. So we looked at those in more detail. And then finally, how does SWIS impact the wider social care system? That's quite important, because obviously this isn't just in a vacuum, it's being put into a wider system, and there are ways in which it can affect it both positively and negatively, and ways in which may be foreseen or unforeseen. So it was important to understand that aspect as well. Okay, in terms of data, I'm just going to grab some more tea. It's really hard to drink tea while you're talking too much. Anyway, so data. So for the impact study and for the economic analysis, it was all quantitative data. And as I said before, we've collected that from local authorities. Key thing to say here, and this is quite unusual, and it's because we had such a good relationship with the authorities and because they worked so hard, but we had no missing data. So we had a complete data set for those analyses, and that's almost unheard of. So that's really good. It's a real strength of the study. Implementation and process data, as I said, it was a mixture of qualitative and quantitative data from surveys and interviews. We were hoping to do this in person, or at least some of it in person, and we were also hoping to do some observations to try and understand what the social workers did day to day. And we had done some of those in the pilots, but because of the pandemic, everything had to go online. And I think that's a shame. I think we could have maybe, it would have been better to do some in-person stuff, but it didn't completely derail us. So we were able to do what we wanted to do, just had to be online. So we had to adapt, which was unavoidable, I think. Okay, moving towards the findings. I'm going to start with the impact and the economic findings, and then Verity is going to talk about the implementation and process findings. So just to start with some sort of descriptive summary things. So one of the things you do when you've got these two groups, once you randomize, is you check that they're roughly the same in terms of some important things. So we thought that school size was important. We wanted to have roughly the same the same proportions of different sized schools in each group. We also thought the percentage of children eligible for free school meals was an important metric to have in both groups, because that's a kind of indicator of, or a proxy for socioeconomic status. But actually what we found was that there was quite a good balance. So we were happy with the way the randomization had sort of panned out. One thing that happened across the cohort and in all of the schools is that there was a slight increase in outcomes over the period of the study. So from the start to the finish, all except for days spent in care were increased over that time. And I think that's probably because of things like the pandemic, general increases in need. As I said, there's been an increase for like 10 or so years, probably 15 years. So it's not too surprising, but it's worth noting. And the other thing is, I've said this again because I think it's so important. There's no missing data, so that's really really key. Now, the key finding is that there was basically no significant difference between the groups on any of our outcomes. But just starting here with the primary outcomes, this is the main outcome from the study. Rate of Section 47 inquiries, these are child protection inquiries. The actual rate was a bit higher in the schools that had SWIS than in the control. It was 5.5% higher, but that wasn't statistically significant. So it's not something that we can, it's not something that is notable really. So as far as we can say, there was no real difference between the two groups. So it didn't seem to make any difference to that outcome, whereas policymakers were hoping that it would make a difference, that it would cause a reduction, similar to what we'd seen in the pilots. Now, the same pretty much is true for all of the secondary outcomes. So it's also the outcomes we looked at alongside, so things like referrals, assessments, number of children entering care, and the days children spent in care. They're all non-significant differences. So the difference was small to start with, and there was no significant effect. So as far as we can tell, there was no difference between the two groups in terms of those outcomes, which is obviously not what policymakers or indeed the practitioners doing the thing were hoping. So that's a disappointing finding, and we'll say a bit more about that later. I mentioned, and Verity's going to go into more detail about this, about the gold, silver, bronze designation that we gave the schools. Now, we were kind of thinking maybe this would help explain the findings if, say, there's a small group of gold schools who did really well, and that's kind of balanced out by lots of bronze schools who didn't do so well. Actually, that's not the case at all. There was no pattern really here. So the gold schools actually had higher rates of outcomes than the control schools. Which is kind of what it's sort of opposite of what you'd hypothesize. We also looked at term data, so we thought maybe, given the pandemic, maybe you'd see a difference over time. So we separated data out into terms rather than looking at it as a whole, to see whether there are any patterns there. But there weren't any. There was no kind of trend. There was nothing that made it seem like certain terms that kind of disrupted the thing. It wasn't really, there's nothing that was notable there. In terms of costs, you might be able to guess what I'm going to say now. Basically, it wasn't thought to be cost effective. The average cost of doing SWIS per school was just over 100 grand. Most of the costs were made up of social worker time. There's a bit of administrative support, management stuff, etc. But the main cost was social worker time, and because the outcomes actually didn't change, we found it was the low probability of being considered cost effective, which is not surprising. Okay, I'm going to hand over to Phil now. We'll have a little discussion break. And if people have questions, we can discuss those as well. But over to you, Phil. I'll have some tea.
Yeah, brilliant. Thanks, Dave. We have had a couple of questions come in which kind of relate to this as well, I suppose. So if anyone has any other questions as well about why you think it didn't do what policymakers thought, please do add the questions to chat box or raise your hand and we can discuss. But the questions that have come in, I guess, that are kind of relate to each other a little bit as well is, so Hannah Lineman's asked if there are any plans to trial this in Wales. And Paul Burbridge has also asked, would we consider rerunning the trial, maybe in Wales, because of the impact of the pandemic? don't know if you want to touch on that, Dave. I guess you talked about it a little bit there, didn't you, about how we kind of started to look at the effects of COVID as part of the trial.
Yeah, and both those are very good questions. I suppose when we planned the simulation, we kind of thought one advantage of doing it in Wales is to try and discuss it in Wales and sort of discuss whether it's something that Wales might be interested in. Now, these findings are obviously not going to make anyone jump to fund it in Wales, I suppose. But I suppose one thing to say is that this is just one study. It's not, it's by no means kind of the last word. Generally, with research, you learn things through it's sort of iteratively through collection of studies. So you generally would have lots of different studies, and some might say one thing, some might say another, and you can do things to kind of average the effects of them and stuff over time. But as I said before, there isn't a huge amount of research in this topic, so this is kind of the biggest study so far, but it's not by any means sufficient on its own. Even though we've got some fairly sort of clear findings. So I guess it depends really on what funders want to do. I think, as Verity will talk about shortly, there's lots of benefits to this, we think. Lots of data that says there are loads of benefits. It was just that the benefits don't seem to be the ones that they thought there would be. So these, or at least observable with these measures. So I think I could certainly see the intervention being kind of reformulated perhaps as more of an early intervention scheme. So it's something that instead of focusing on these statutory outcomes, maybe focus on different outcomes. I think that would be worthwhile. And there's no reason why Wales wouldn't be a place to try that. But again, it depends on funders and commissioners and people like that. And I guess, that's kind of up to them. And the second part, second question, I think for someone else, is about the pandemic, which is also an interesting point. We've actually got a half-written paper about the impact of the pandemic because we collected lots of data about that, and actually overall the impact was negative. Obviously, it reduced the amount of time social workers were in schools were closed for a lot of time, etc., etc. But there were some unexpected positives. So having a social worker in a school meant that they were kind of within the bubble of the school, and it actually it gave some schools more ready access to social work support than they would otherwise have had. Social workers were also able to do home visits more easily and that sort of thing. So there were some benefits associated with the pandemic. I think one of the things we expected was actually some sort of pattern over time. So we isolated the sort of terms when the pandemic was most acute. But surprisingly, we didn't find any obvious differences there. So I think it sort of remains to be seen really whether how much of an effect the pandemic had. And I guess that might be another reason that the commissioners might want to try the trial or a different type of evaluation at a different point in time. So yeah, and that's what I'd say about that.
Do you want to add anything, Verity, or?
No, I think, just everything that they've said have been really important findings of the process evaluation. In terms of the pandemic effects, I think it was just really interesting for because obviously we launched the start of the intervention was during those really turbulent times of having lots of school closures. And I think that was an added pressure on sort of getting the implementation set up and ready to go. But I'll talk a lot more about all the implementation and process stuff when I come to that later.
Yeah.
Thanks, Phil.
Okay. Yeah, there's a couple of other questions, and I remember us kind of talking about this at the time as well. So we've had questions from Emma Taylor-Hill and Helen Priest. We're just thinking about why the numbers might have increased for Section 47s. So was it something to do with the fact that we were picking up, the social workers, were picking up these safeguarding issues more commonly? And I think we expected that to happen, didn't we, in the early stages, that Section 47s would initially increase. But over the long term of the trial, that obviously leveled out then, and we didn't see that what we expected.
Yeah, I think there was think there's a sort of exceptions that they might, putting a social worker in school might mean they uncover more need. That's a perfectly logical thing that might happen. But I think the idea is that might happen initially and there might be a spike, but over time, as Phil said, you'd hope to see a reduction. Helen's question about the increase of county lines activities as well. So I think, yeah, increase in county lines activity and then sort of other things, the pandemic causing other things like mental health difficulties increasing. Those things all happen for sure. But I suppose the thing about, one of the good things about study design and having a comparison group is that there's no reason to think they would be different between the groups. So if those things increase, then you'd expect them to increase for both groups, rather than kind of one or the other. So I think that doesn't seem like something that would have affected the result, although it would have been a context for the study for sure.
Yeah. Does anyone else got any other questions specific to why we think this might not have panned out like policymakers thought? I've not got any, can't see any hands raised.
Questions or just comments or
comments
or ideas or hypotheses, anything like that, really. People want to.
Helen's saying those things might not have been picked up in the control schools.
Yeah, so they would have been in the data from local authorities still. So we got the same data from each group essentially from the local authorities. So we would have known if there were more referrals, for example, in all the schools involved. Okay, shall we? What's next? Is it a break?
We can have a break. Helen's raised a hand, but I don't know if that's the same question. But Helen, you should be able to speak now if you're mute.
Yeah, I'm thinking it's not about what's being reported, but are those things like county lines activity or neglect being recognised in the control schools? I know that neglect is often an issue that is not picked up by school professionals.
Yeah, I didn't understand your point. Yeah, that's you're right. So it may be that, I suppose that goes back to the thing about sort of social workers recognizing need more, and as you say, them being in the schools, maybe they pick it up more. So that is potentially an explanation. And I think one of the things that people say as well, why did the policymakers think they would end up with a reduction as a result of this? It's kind of, for some people, I think it's like it doesn't make sense, the sort of theory of it. So that's, and I think that's a reasonably good point, really. I think it's you can definitely see how it could lead to an increase. I guess over time they were thinking that there would be a reduction, but that obviously isn't what we found. So yeah, you might be on something there, I think.
We've had a question from Emma, but I think that might be come up in the discussion after Verity's talk, actually, about the length.
Yeah, I think this might be one to come back to after Verity's done her bit, because some of it touches on that.
So as Dave mentioned in his introduction, one of the main questions of the IPE is, was SWIS implemented as intended? So the local authorities were provided with a manual at the beginning of the trial that set out recommendations for implementation based on findings of the pilot studies that were done before this study. And examples of that guidance are things like the social workers and the team manager should be recruited from within the local authority, and that the social workers should have at least 2 years of experience post-qualification. Also, that the main focus of the SWIS trial was to carry out statutory social work in schools. So that was recommended as being the focus. However, this manual, as Dave did also mention, it wasn't 100% prescriptive, and it did leave some room for variation and flexibility. So in addition to whether SWIS was implemented as intended, we also measured how SWIS was implemented differently between different local authorities and schools. So getting social workers into post is obviously a key element of implementation. And this figure here on the right shows time from left to right, and each main column is a term. Hopefully it's big enough on your screens for you to be able to see that. So each individual small row represents a school, and these have been grouped into different local authorities in blocks. And where you've got orange squares, these represent each week that a social worker was in post in a school, and the grey squares mean that there was no social worker in post. So you can see that there was quite a significant sort of recruitment drag within the first term, that first column on the left, whereby it took most local authorities until the end of the first term to get a social worker in post in their schools, and quite a few schools actually didn't have social workers in post at this point, and they were sort of coming into post in the second term. There were also some challenges in retaining social workers and gaps in the delivery. So the orange represents the first social worker that was put in post in a school, blue is the second, and the greens are the third and fourth. So you can see that some of the schools were onto their second social worker towards the end of the first year, and certainly by the beginning of the second year in term 4, lots of schools are there in blue, having sort of moved on to their second social worker. And by the end of the 2-year trial, there were also quite a few schools that you can see highlighted in green that were on their third or fourth social worker. And between these different social workers, there are also sort of slight gaps in delivery where there wasn't a social worker in post whilst they were waiting to recruit the next one. The recruitment source also varied. Some social workers or some local authorities recruited all or most of their social workers internally, as was recommended in the manual. So that's represented by the green on this figure. Others had to go externally to recruit workers into the post, and others predominantly had agency social workers, or sort of, once they're getting onto their second and third social worker, they had to go to agency. In some local authorities, having agency social workers is the norm. Most of their social workers are recruited via agencies, and that is also somewhat reflected in that recruitment diagram there. But overall, most local authorities had a social worker in post in most of the schools for most of the time, except for the first term. So you can see there that kind of red and orange column representing term 1. But sort of overall, the vast majority had social workers in post for more than 70% of the time, which really is pretty good going in terms of implementing having a SWIS in the school. So the focus of the work that social workers undertook really varied across local authorities. Generally speaking, they can be described on the spectrum between those that really focused on the preventative work and the lower level sort of social work before you're getting into the statutory level work. And then at the other end of the spectrum, you've got those that really focused on statutory work and pretty much only did that and didn't do any early help. And then, so between sort of those two extremes, local authorities, I suppose, could be plotted along that spectrum. For example, local authority 4 really sort of seemed to sit right in the middle, doing 50% statutory and 50% non-statutory work. And they limited their caseloads evenly between the two types to make sure that they really had a balance between the two. So the distribution of sort of statutory social work, lower level work and other kinds of work, so like collaborating with school staff and things like that, also varied between local authorities, but also between the schools themselves. And balancing these different priorities was one of the most widely discussed interview topics, I think, I spoke to social workers about, definitely. So most did do a mix, but obviously the balance of that mix varies. This figure, every row that goes across is a different school, and it's grouped by local authorities down the left-hand side. And you'll notice that we haven't got as many rows as we have schools, because this was taken from survey data. So this is just based on those that managed to complete the survey, but it gives you a really good overall picture of the variability of the mix of work the social workers were doing in their schools. Caseloads varied also quite considerably between the local authorities. Some local authorities were able to keep caseloads quite low. So, for example, Local Authority 1 at the top there, and also Local Authority 9, I think you can see are sort of really towards the lower end with the caseloads, whereas you've got Local Authority 21, Local Authority 2, who are significantly sort of higher in terms of the number of cases that they were taking on. However, sort of there was variation, but most of these local authorities were able to sort of keep caseloads lower compared to what the local authority average was. So in this graph on the right here, we've got, there's a line in the middle for 0. So that is the average for each local authority. And you can see most of these box plots are happening sort of going on to the left of that line, although there are still some SWIS social workers, so again, Local Authority 2 and Local Authority 21, where they were actually taking on more than the local authority average. So Dave has spoken a little bit about the gold, silver, bronze measure that we use to measure implementation quality. So this was an approach we took in order to quantify some key aspects of implementation. So we developed this novel gold, silver, bronze rating system in order to kind of summarize implementation as a whole for each school. And this is based on evidence of implementation across several domains. We calculated 2 slightly different versions. One which included just the domains set out in the manual. So those are topics that are highlighted in blue in this list. And then a second which included all the manual items plus some other aspects of implementation which we deemed to be quite important, and those are highlighted here in yellow. So we did sort of calculate 2 different versions. They both came out with incredibly similar results. And the topics that were included were things like embeddedness and time in school. So whether the school was a primary base for the social worker or not, the level of access they had to resources. We looked at integration. So we had termly staff surveys, and in those surveys we had a measure called the Team Climate Inventory, which was really a measure of how well the social worker and school staff felt that they were operating as a team. So that was quite an important measure of integration relationships for us. We also looked at the social workers' access to school safeguarding systems like CPOMs, and we looked at how well the social worker and the school felt that they had agreement on goals and values. We looked a bit at workload and wellbeing. I've already talked about sort of the caseloads and how they compared to the local authority average. We also asked the social workers whether they felt the caseload was manageable and whether they had capacity to do quality work. And we used another survey tool called the General Health Questionnaire as a measure of social worker wellbeing as part of that domain. And then we looked at personnel, so years of social worker experience, and also years of experience that social worker had working within that particular local authority. We looked at whether the social worker was recruited from within the local authority and the total number of social workers that a school had. We looked at management oversight, so whether the SWIS team in a local authority had a single dedicated team manager or whether that was more fragmented. We looked at whether the social workers felt that their manager understood and supported the SWIS role and function within the local authority. We had a manager star rating, and we also measured whether the manager was recruited from within the local authority. Then we looked at deliveries. So as I mentioned before, in the manual suggested that the main focus of the role should be statutory social work. So for all those social workers that did at least 50% of their time working on statutory caseloads and statutory work, they were assigned gold. And then, anyone less than 50% was considered a sort of bronze level of implementation. And then we also looked at social worker presence as well. So the percentage of the total number of intervention weeks that school had a social worker in post. So that's really sort of like a very swift description of a lot of very complicated and detailed sort of factors of implementation. And the aim of the gold, silver, bronze was really to kind of simplify that into a simple measure that would assess how well each school had implemented SWIS. And overall, we found that SWIS was implemented relatively well. So most of these schools achieved a gold rating when all these different various aspects of implementation were considered. So although implementation did vary a lot, in terms of how it was delivered relative to the outline of the manual and those other factors that we felt were important for quality of implementation, the majority of the schools did do really well. So that's kind of like a really swift tour of implementation. And another one of our questions in the IPE was, how does SWIS impact the wider system? So we wanted to understand really how SWIS fitted into the local authority social care operation and the impact that it might have had on other elements of the system. And SWIS involvement, we know, varied across different levels of social service provision. I talked a little bit about sort of the balance between statutory work and lower level work, but within that, there was also sort of variation in the types of statutory social work that were being done by social workers. And additionally, SWIS team involvement, that's a tricky one to say, their involvement in threshold decision making also varied between the local authorities. And both those factors really shaped the extent to which the flow of referrals from schools to local authority screening teams to service provision deviated from what would be considered usual practice. So business as usual generally would see referrals and case allocation flow through the social care system, as is shown in this flow diagram. It is a little bit simplified, and there are sort of slight nuances in different local authorities, but generally all 21 local authorities agreed that this was the general business as usual model. So you would have the school referring into the front door of the screening hub, and sometimes it's called MASH, and similar things like that. That screening team then decide whether or not the referred case meets a threshold for social care involvement. And if it does, it then gets referred on to social workers who will do those initial assessments, and then those cases will be referred to the relevant local authority teams, or they'll be referred to other services in the community, or there'll be no further action. So that's sort of the general business as usual model. And the way that SWIS modified this system varied across authorities, as you might imagine. And we were able to identify 4 distinct approaches to how SWIS fitted into this system. And I'll talk through those briefly now. So the most common model was for the SWIS social worker to take on all the statutory cases in the schools. So this included initial child looked after work before those would then be referred onto the longer term teams. The SWIS didn't officially operate at the level of early help, but they would often be providing support to early help workers. So there would be some collaboration there. And this model applied to 12 out of the 21 local authorities. And then there were a couple of others that probably fitted this one more closely than they would others. So this is by far the most common way that SWIS operated. And then the second model, the SWIS took work across the full breadth of thresholds, including early help, and from there upwards, everything was allocated to the SWIS team if it was coming from one of the SWIS schools. And this was a case in 3 of our local authorities. And then this slight modification, the third model, it involves some shorter term child protection work being done by the SWIS social workers and shorter term child in need work. before those cases are then transferred onto the local authority teams. So the idea in these local authorities that implemented SWIS in this way was that they would do the shorter term work, but move that on to longer term teams if it wasn't sort of, something that could be done in a couple of months. And 2 local authorities operated in this manner, and another followed this model, except that for child protection cases, the SWIS would only take child protection work if it was a student that they had already been working with at a lower level and they'd been stepped up to the child protection level. Otherwise, they would be sort of sent to the local authority team straight away, and the social worker in the school wouldn't necessarily be involved with that case. And then the 4th approach was only used in 1 local authority, and it's really quite significantly different from how the other SWIS teams implemented SWIS within the wider system. So they were really focused on early intervention, lower level safeguarding work. And they did take section 47, so that's the kind of child in need level cases. But they weren't being held at that level, if that makes any sense. So they would kind of work with those families without referring them through the front door to the local authority. And so they wouldn't be stepped up to the level of child in need, but the social worker would still sort of do a lot of that kind of level work because they were able to in the school and they already had relationships with the child. It made more sense to them to do it that way. These social workers were also making the threshold decision. So the school would talk to the social worker and the social worker would identify potential sort of cases within the school. But the school wouldn't be having the direct contact with the screening team. Everything would go through the social worker and they would be making the threshold decisions, which is, in lots of the other local authorities, there was a lot of collaboration between the SWIS team and the front door team, and quite often the SWIS would still technically be referring into the front door team, but saying, this is my recommendation, this is what I think, being the person on the ground working with this case, I think this meets threshold for my involvement, or I don't think this meets threshold, and it would be more of a sort of collaboration. So that was quite interesting, the way that 1 local authority chose to do things. Okay, where are we? So that was implementation, and then the next part of the implementation process evaluation is process. So this side of the study was looking at the theory of change and the mechanisms by which implementing SWIS might result in the outcomes that were anticipated. So in a nutshell, the theory behind SWIS is that by placing social workers in schools, this increases the opportunities for lower level preventative work, and it also improves interagency collaboration between education and social care. And then that is hypothesized to affect a reduction in referrals to social care, a reduction in section 47 investigations, and a reduction in days in care. So that's a very simplified sort of logic model. And building on work started in the pilots, we were able to produce a much more detailed model of the mechanisms through which SWIS was perceived to operate by those involved. So apologies, this is a really large flow diagram, and you may not be able to see it on your screens, but I'll just zoom in now for a bit more clarity. And so across the top of the logic model, we've got key enabling contexts that were identified as social workers having limited caseloads, social worker being physically present in the school, and a compatibility between the social worker and the school. And those things were viewed as being really, really important for SWIS operating well. So what do I mean by compatibility? Well, this refers to how far individual social workers were considered a good fit for their allocated schools. And the levels of agreement around expectations and understandings of the social workers' roles and responsibilities. So qualities deemed important for the social workers to be considered a good fit included being familiar with the local area, being experienced and knowledgeable in social care, being proactive, and being approachable and friendly. And then qualities that were deemed important for the school to be a good fit for the social worker included being receptive and welcoming of guidance, support and change. And this was really seen as being very important where the school had less knowledge of social care, or they felt like they were struggling safeguarding, or felt that local authority thresholds were far too high. And it's exemplified really well in this quote from a designated safeguarding lead in a large school, who said, "I'm the student welfare and safeguarding officer. We've got 1,000 students with a lower school and upper school and a sixth form. I'm pretty much the hands-on safeguarding person for the whole school. Because I was the only non-teaching dedicated safeguarding member of staff, the majority comes to me. The SWIS social worker is amazing. They just integrated themselves into it. The MASH referrals have definitely reduced, and that's reduced the pressure on me." So within those top sort of facilitative contexts, there were lots of mechanisms of sort of how SWIS was reported to function. So I'll just sort of skim across the top of the model now, and then we'll go into more detail in some of these points. So key things that were enabled by those contextual factors are that school staff, students and parents could access a social worker when and where they wanted to. The social worker had frequent informal interactions with school staff, students and parents. The social worker had the capacity and flexibility to balance statutory and preventative work. And this is obviously really, this is an important context here, that social workers had limited caseloads. Having limited caseloads meant that they'd have capacity to do that and lower level work, it was felt. And then also having more opportunities for consistent child-focused work with school staff, students and parents. So in terms of quick and easy access to the social worker, this was seen as being a key benefit of SWIS, and both the timeliness of being able to access a social worker easily and the additional support that you get from being able to access them was seen as playing a really key role in reducing the risk to children. And this was because bringing the social worker into the community meant that students and staff could access their expertise and their advice on their own terms. So that means at times that suited them, rather than it being sort of on the social worker's terms, how it often is when the social worker is placed with the local authority. And of course, the physical presence within school buildings was really particularly important context for allowing this easy access to occur. And this is highlighted by a student from one of our local authorities who said, "It's handy for when you need someone to go to that's right then and there." And I think that is a really nice simple quote that really sort of emphasises how important that easy access was. And some SWIS social workers cited that school staff and parents and students being able to access them within the community was a means of improving relationships and overcoming some of the stigma around social care that make engaging with families really difficult. So one social worker said, being known to families that were in school and being part of the school was important. Some families can be really resistant. They hear social work and they think, "Oh my God, I don't want a social worker. I don't want them involved." And I think being part of the school community may help. What I've experienced so far is families have been welcoming to that. So it's changing their perception to some extent of actually what a social worker is. So when social workers are based in local authorities, their reasons for interacting with school staff and with students and their families are typically perceived as being relatively formal and often a bit negative. So you're seeing a social worker because, you know, something's gone wrong, there's a problem. And conversely, when social workers are based in the schools, they have the opportunity to have these frequent and informal interactions with school staff and with students, families, that aren't always associated with sort of the more negative connotations of social work, and they're not as formal and they're a bit more relaxed. And these interactions often included things like just kind of chatting in staff rooms or outside during busy times, sitting together in offices, checking up on people's well-being and highlighting other support services. And the social worker also would be spending more time with talking to or hearing about students. And as a result of that, they kind of get to know the students and their circumstances better. And it was felt that this not only helped to form and improve relationships with the students, but also that they felt their knowledge of the students helped them better identify if any changes were occurring in their day-to-day behaviour or appearance that might be things that indicated concerning signs. And as a result, they'd be able to step in and help them sooner. So that additional face-to-face contact also served as a constant kind of visual reminder that the social worker was able to provide support. They became better known, less intimidating, and more familiar and approachable. And so both being more comfortable around the social worker, it was felt that this increased the likelihood that all these other sort of partners, the schools and the students themselves, would be much more likely to go to the social worker to talk to them and ask questions or seek advice. So this is a quote from a social worker from one of our local authorities who said, "I think parents have often prepped a young person for, oh, a social worker's coming. But I think they see me in school and they see me as someone they can pop in and talk to. And that boundary is slightly different. It makes it more approachable, a more accessible role for young people to kind of see that I'm not like the enemy that's going to come and whip them away out of their home." Okay. So preventative work. So in contrast to when social workers are based in the local authority, social workers reported having capacity and flexibility to do more early intervention and support with families who didn't necessarily meet those higher thresholds for social care involvement. And this lower level work was really valued by social workers and also by the schools and students. It kind of included brief targeted support for students and parents, where social workers could work really quite differently compared to the school staff because they had very different skills and they had more capacity and authority in a way to get involved in a different way than school safeguarding staff could. And students who may never have been identified by social care, either at all or maybe not until risks had escalated, were able to receive support that was designed to prevent that escalation. And again, another theorised sort of outcome of this type of work was that it was felt to improve relationships of social workers and perceptions of social care more broadly. So social workers would be seen as coming in to help at the point at which that help is really beneficial, rather than sort of coming in at an absolute crisis point. So this is a quote from one of our social workers who sort of described this really well, I feel. So they said, "I've been doing a lot of sort of one-to-ones with young people. I've been attending a lot of team around the family meetings, consultation with early help. So I've been doing a lot of preventative work as well as my caseload work and a lot of discussions with the team in there, the designated safeguarding leads and head teacher. So I do think that preventative work, so say, for example, school identified a girl who kept going missing. So I did some STEP preventative work with her around keeping safe, safety planning, and like obviously risks within the community and that was really useful. And I think sometimes that does stop things escalating. And so just to talk about this sort of final instigator of one of the mechanisms, so sort of having this consistent child-focused work. Reportedly, this sort of increased communication and the sharing of information about at-risk students and their families, sort of including the history, the current concerns, and the students' views as well. And by sort of having this consistently child-focused work, the school staff and the social workers were able to build a fuller picture of what the students was sort of going through. And they worked together by sharing ideas, troubleshooting, making quicker decisions. And this was really thought to result in students being offered the right support seen there, whether that was early intervention or preventative work or statutory provision, or maybe even just a referral to other services in the community. And because the social worker had more opportunities to manage and monitor risk than they would when based elsewhere, support could be amended to reduce the chances of escalation. And again, it was felt that sort of this kind of work was also really beneficial in building relationships. So if I just zoom in here, this is sort of, this section with the sort of multiple outlines is really emphasising the importance of relationships in our logic model. So the forming and improving of relationships was just so incredibly intertwined with most of the causal pathways through which the SWIS were thought to be producing outcomes. And, there were just really lots of benefits that were thought to arise from relationship building, including improved perceptions of social care, reduced stigma, and sort of opening up that door to social care so that young people could get help when they needed it. So just to touch on relationships one final time. So for school staff who scored their relationship with the social worker highly on the team climate inventory scale that we include in the staff surveys, had the following things to say. So one said, our SWIS social worker has been absolutely fantastic. The difference they've made in 6 months has been phenomenal. Not only have they become a valued member of the school team, they've built working relationships with many students and families. It's been eye-opening for them to see the relationship and responses between the local authority and schools. And another said, this project has been absolutely amazing and it's really created a feeling of working together with social services. We're able to have the expertise on site to tap into without lengthy waits for callbacks. And so I'm just checking how I'm doing for time, I think.
Yeah, we've got 15 minutes, Verity. There's a few questions in there, but to go through as well. But
thanks, Phil. So I will just gloss over really quickly the student perspectives. They really sort of echoed what we were hearing from the school staff and from the social workers in the school. And overall, students did have a positive opinion of the social workers. These are results from our student survey that we sent out to all the schools in the intervention. Those that had been made aware of the social worker felt that they understood the role of the social worker. And a large percentage of them, particularly those that were involved with the social worker, felt that the social worker made school a safer place. And some of the things students had to say, I'll just spin through these really quickly. So I can talk freely without worrying about how it might affect my school or how they view me or how my next lesson will go. We don't have to organise what days they have to come at home. I can do that for myself. I can work around what I've got. And I feel like I have a sort of extra layer of support, and it also helps me connect home and school. One student said they make sure I'm safe and they're just someone to speak to. And another said it makes children feel better. If they're struggling with mental health or they really need someone to be there, they know that there's someone there. And this echoes a lot of the points I made just now about the social worker being accessible and being available to the young people. So this is my final slide now, you'll be pleased to hear. So I think hopefully you'll agree that in all that evidence, we really are seeing increased opportunities for lower level preventative work within SWIS. And there really was improved interagency collaboration between education and social care. I think those things were really quite clear. But what we're maybe not seeing is the connection that was hypothesized between those things and all the positive sort of knock-on effects and mechanisms that they have creating intermediate outcomes. We're not quite getting to this yellow box where we're seeing that reduction in referrals, a reduction in Section 47s and a reduction in days in care. So that is just a really quick tour of of a lot of work that was done on the IPE, and I think that takes us to our final discussion point. So I'll hand over to you, Phil, now.
Oh, thanks, Verity. Yeah, it's fascinating, so interesting, isn't it? All that work that went on, and definitely feel like there was, what the students said to us, there were a lot of benefits beyond obviously hitting those key kind of metrics in terms of how they felt in school, having the social worker there. Emma's asked a good question actually in relation to kind of not seeing that impact and whether it's something to do with the length of the trial. So obviously quality of the relationships was improved, but could the outcomes have been better in the longer term? And is that something we're missing through the analysis? So we might see that those benefits, a few years further down the line.
Yeah, I mean, I suppose I think if we were going to sort of see that, we would be seeing some indication as time went on, and I think that wasn't reflected in the results. Is that right, Dave? So there weren't any of these sort of green shoots that were showing perhaps promise or pointing towards there may be being an increase in those kind of outcomes through time. It might be that these things are outcomes that come a heck of a lot further down the line, and there was no way that we could have measured that in a 2-year trial, but we don't have any evidence that would suggest that's the case. I think is the answer to that.
Yeah. Do you want to add anything, Dave? Or
well, yeah, no, I think that's right. I think it's obviously possible that maybe these outcomes would sort of materialize over a longer period. And one thing to say is that the trial was meant to be a year originally. It was extended to 2 years, maybe because of COVID, but also because I think people realised that some of the outcomes might take a bit longer to come along. But yeah, like Verity said, we when we looked at it over sort of month by month, we couldn't. I think you'd hope to see some sort of indication that things might be. The outcomes might be changing over in the last few months, but we didn't see that. But there's nothing, that you can't say that maybe you can't say they wouldn't have changed over a longer time period. Obviously, funding studies like this for long periods of time is difficult. But the other thing to say, I suppose, is that I mentioned the educational outcomes that we're looking at. We're looking at them at the end of this year. We're also going to look at care outcomes again over the longer term. So it could be that actually there is an effect that it's sort of delayed, and hopefully we'll be able to pick that up.
Yeah, Charlotte's asked about that actually, in terms of what if you find increases in educational attainment attendance, would that change the policy implication at all?
Well, yeah, so I think it'd be interesting. And I think my guess is that if there's one outcome that there is going to be an effect on, it's attendance, because we had lots of qualitative evidence of social workers kind of helping kids get to school and seemingly increasing attendance, and that's one of the things we're looking at this year. So it might be that it improves attendance. It might improve attainment, but I'm less confident about that. But if it does improve attendance, I guess policymakers need to decide whether it's that, maybe that's something that they want to explore further, and it's certainly that would be a good outcome. It's just not quite it's not the main outcome they intended at the start, but it's also obviously something that's important. So I guess the justification for the intervention might change, but that's not necessarily a bad thing. It's it'd be interesting to see what we find.
Yeah. Paul's asked whether the challenges with social work recruitment and retention, did that impact on being able to build working relationships, particularly where schools had 2, 3 or 4, even 4 social workers over the trial period?
I think that's definitely the case. Yeah, I think we had people saying that the schools were frustrated when they had, as you say, some of them had 3 or 4, and it's the sort of thing that I think this relationship part of it is so important. So if they had to kind of keep restarting at square one with a new worker, then that was frustrating. Some of them, though, actually having a change in social worker was quite a positive thing because they didn't get on with the previous one. So it can work both ways. Yeah,
I was about to say, if it happened that they had a really good one and then they got someone who they felt wasn't as good, then it'd be more frustrating.
And occasionally the new social worker would be someone who was working within the SWIS team already, and social workers didn't always just solely work with one school. Some authorities took more of a team approach to handling things and sharing caseloads. When things got too high in one school, another would step in, and sometimes when that social worker moved on, someone who already had a relationship with that school would move in. It didn't happen all the time, but sometimes that was what was happening, which made things easier relationship-wise, certainly.
Is that something that came through in the recommendations about having some, based on context, you would need potentially some schools who were larger would benefit from having more than one social worker, or like you say, having a social working across a number of small schools, so changing the format could make a difference, I guess.
Yeah, and some social workers worked in a kind of buddy system kind of way, where they would pair up social workers within the team. So maybe when one was off on leave, that other social worker would be in charge of, sort of overseeing things in that school, or, if caseloads got too high. So they weren't just randomly allocating to anyone in the team. It was like a designated sort of second, I suppose, for that school. And I think that worked quite well, and particularly where there was a disparity in the size of the school. That certainly came up, that some social workers felt, if they were placed in a really small school, that there wasn't loads of work for them to do, and others were thinking, there needs to be 2-3 of me in this school, because there's so much going on.
Hannah's asked about the how informative were the TCI and GHQ 12 measures in relation to the qualitative data. Do you want to pick that one up, Verity?
Yeah, so they were really interesting results. There definitely was a range in terms of sort of ratings for team climate inventory. As we've already talked about, there were some schools where maybe sort of the social worker left because there wasn't, they didn't have that good fit with the school. So in terms of how the team climate inventory picked up on that, I think it was quite a good indicator. And equally with the GHQ 12 questions, now sort of casting my mind back, I think that the general result was that the mental health of the social workers working in schools was perhaps slightly better, Dave? Do you remember, than it was in general across? But I mean, it's really difficult to say, because we didn't measure this with social workers who weren't working in school. And obviously it was a really high stress time working with schools during the pandemic. So it's a little bit difficult to we couldn't do any comparative analysis, I suppose, with that. But it did feed into, we sort of had there's a threshold level within that score that we would say anyone who scored over this threshold were probably not doing as well in their well-being, and that fed into the gold, silver, bronze calculation as being sort of like a less than ideal kind of well-being score for that social worker. Because obviously if the social worker is happy and sort of feeling well, they're going to be able to have more capacity to do better quality work. That was the logic behind it. Yeah,
I've got a feeling, I don't know if I might be imagining this, but because there's various other studies have used this measure GHQ with social workers. I think when we compared it to some of those other studies, the well-being was the rates of people who are above that threshold were lower, I think, but don't quote me on that.
Yeah.
Okay, so just a few sort of concluding thoughts to finish off with. So as we said, the study itself was a success, but the findings were disappointing, and certainly the impact findings were disappointing to many of the people involved. I think a lot of people felt it was a good thing. As Verity demonstrated, there was lots of evidence of benefit, just not in terms of the outcomes that we looked at. The reception was therefore quite muted, I thought. So there's another study that's come out recently of similar size, similar design, and they had a positive finding, came out last week. And the reception's been quite different. There's been lots of sort of fanfare, which is probably understandable, but I think it's important to learn about things that don't work as you expect as much as it is to learn about to learn from things that have positive findings. And actually for policymakers, I think it's just as important to know if something doesn't work or doesn't do what they intend it to do. and what other benefits there might be, because that helps them make decisions about how to spend the limited money they've got, for example. And I think that's that's an important contribution to make. I think there might be one more slide. Yeah, okay, so we know that some of the local authorities involved are continuing with the SWIS, based on the idea that, well, the fact they think it's beneficial for various reasons. They feel that they've got better relationships with schools, etc. And I think some of them are probably adapting it, and I think some of them they've talked about making it a more of an early intervention type focus. So that's also interesting. Nonetheless, the DfE are no longer planning to continue funding it, and I think they would have scaled it up to more local authorities had we had a different result, but actually they're not doing that. So it's kind of back to the drawing board for them. But yeah, so it is continuing in some way in some places, and I think the point made earlier about the sort of future evaluation is an interesting one. I think there is scope for testing it in different ways or for different outcomes. Obviously, we have to see what funders and commissioners and elected representatives decide to do. But thanks for coming, and thanks for your input. I know that there are lots of questions in the chat, so that gives us lots to think about and to take away. So thanks again, and yeah, thanks for coming. Have a nice rest of your afternoon.